mandatory use of public health care by public officers.
Yes.
And my question is, why do these officers they shy away from using the
that question you should
hospitals?
ask Osoro, because he's the one who shouted loudest the knee. You should ask him why. Because in the 70s, and if you interact with somebody like Dr. Nyikar, who was a PS those days, who has been a medical director, even the first president of Kenya, used to go to hospital in Kenyatta Hospital. Presidents of East Africa, they used to come to be attended in hospital at Kenyatta National Hospital. But what we did is that we commercialized our healthcare. The same doctors we have employed in Kenyatta are the ones who are running private facilities, are the ones who treat us in private hospitals. So that is why you'll go to Kenyatta, you want to go and do maybe dialysis, or you want to go and do chemo, you're told you can only come after 3 months. Our oncology is busy. They're not busy. They are running their own private facility. And you'll be told, but now, because you'll wait for 3 months, there's another hospital you can go, you're given a paper, this one, you'll get your chemo now. And you're told how urgent it is. And you can imagine we have told somebody they have cancer, how desperate they are. So we have been taking advantage of our patients. And that is why even those cartels in the health sector used some of the members yesterday to say nay. And unfortunately, also, when I was just walking in, and I was waiting for the questions time to order number 7 to be finished so that order number 8 can be called. My order was called earlier. There was some urgency because I was not in the house to get to order number 8, and then they go back to order number 7 so that they can say nay. Shame on them. I am one disappointed person. The amount of money we are spending on insurance, and I only just want to take, and I was saying, if you can afford your private medical care, you can go to a private hospital. No one is asking you. But members of parliament, even take parliament by itself, if that money, when I get sick, I am going to Kenyatta, I'm going to KU referral. I even challenge members, if you get sick, when I get sick, I'm in Murang'a. Am I sure that when I walk into Murang'a General Hospital, that I'll find a doctor, that there will be medication, that they're going to be of high standard? Because when you're talking about UAC, and this is what you're telling people about SHA, then why do you tell people to register for SHA? And you want to put money in private, in public sector, but you want to promote the private sector. And I have no fight with anyone. Mine was, let's put our money where it is needed. Instead of my deduction, every month I'm deducted 30,000. If I was to get a private insurance, it would have covered me for a whole year. But now we are saying this money that we are getting, let that money go to private institution. Then we'll have, I found some doctors or nurses, I don't know whether they're clinical officers, here at the gate. We will stop the industry unrest that we have been having. Because we will employ enough doctors, we'll have enough money. We don't have to go back to the exchequer, because the same exchequer money that is giving private insurances our money is what we are saying, don't take it to private hospital, take it to public facility. So can we first trust in our own institution first, before we say, now we are telling the public to come. So I want, when I walk into Kenyatta Hospital, like I can walk in, I'll find a doctor, I'll not find a line, I'll not find somebody who got an accident last night who is still lying at accident and emergency. And the only way we'll have a wake-up call for the doctors, and the machines are working, and people know sabotage those machines to send them to a private one, because they know if I don't do a scan here, you don't enjoy the money for SHA. And the biggest question I asked the Minister of Health is that, what are the statistics? How much money have we paid so far from them we started SHA to private hospitals vis-a-vis what we have paid to the government hospitals? And later, I'm saying all is not lost. Mine, I am going to push it, and I'm not going to relent. And what I want now, because we have private insurances, NHIF before used to have a cover for the police, and was a very nice comprehensive cover, which was better than what they have now. And if we can use that as something we can learn from, that means we can have SHA comprehensive, where all state officers will have that card. SHA comprehensive. That comprehensive cover, they only need to look at the policy, because this is an insurance. You see how they can work around it, so that we have a national insurance cover for medical. Okay. And then that means all the money will go back to the government. And I don't think the government will steal from itself.
Okay.
So then we can have enough doctors, enough nurses, clean hospitals. We will have hospitals where patients are not sharing beds because we'll have enough resources. Actually, if we are able to plow that money back to the public facilities, that means we will not even have people going and you'll hear the body has been detained, because they will have a clear, process. By the time you come in, you don't have an insurance. Or why don't you have an insurance? So then family background. So by the time somebody is dying, you don't have to go and beg a social worker to release a body. Because what business do you have with a dead body? When somebody is dead. So you'll have known this family. If you ask them for 100,000, they will only afford 10. If they bring that 10, release the body, because already the structures are so well done. From the time that person was admitted, you can tell how they came in. It was an emergency, or they came with a relative, or it's somebody who was, gotten from a known place. So this person has no one who can take care of them. Mm-hmm. How can a woman go to Kenyatta and give birth, deliver? Then you detain the child there with the mother. So what is more expensive? Having a mother and a child staying there, eating your food in the name of you are waiting for them to pay 1,000 and they don't have the money. So we really need to work on our health sector. And I always say, where there is a will, there is a way.
Okay.
I am